Welcome to your session on anaphylaxis. Over the course of this video, we're going to have a look at what causes anaphylaxis, what happens in the body, and what immediate actions should be taken if you recognise this in someone. This will include following an ABCDE style of assessment, calling for help, and using the right treatment process. Anaphylaxis is a severe and potentially life-threatening allergic reaction, and you must act quickly to ensure that the casualty doesn't deteriorate further. For anaphylaxis to occur, a trigger, medically known as an allergen, must enter or come in contact with the body. This can happen through various ways, inside and outside of hospital. The main ones being food, such as peanuts and shellfish, insect bites or stings, latex, IV drug therapy, blood administration, and the introduction of anaesthetic agents into the body. There are of course other things that can cause allergic reactions. These are just some of the more prominent ones that we may encounter. In hospital, drug reactions can occur very quickly, so it is important to record vital signs and observe your patients continually when giving new drugs, for example, antibiotics or during procedures of blood administration or anaesthesia. Drugs such as contrast medium in CT and iodine for procedural sterility also need careful monitoring for allergic reactions. If a reaction occurs, please immediately stop the infusion or administration of the treatment and quickly look to treat the patient's symptoms. This reaction will normally occur within 5 minutes, although some reactions may be quicker. This is a systematic approach to the critically ill or injured patient and stands for airway, breathing, circulation, disability, and exposure. When managing a deteriorating patient due to anaphylaxis or any other condition, it is vital that we follow a structured method of assessment. By doing this, it allows us to identify and treat the life-threatening problems first, and gives us the framework to complete a thorough assessment. If you suspect an anaphylactic reaction or feel that the patient is deteriorating in any way, please call for help. This may be a simple shout for help or pull in the emergency call bell. In order to access the medical emergency team, please call 2222 and request a medical emergency and anaesthetic emergency, stating the location you are in. Finally, locate your nearest emergency trolley, which will have the life-saving equipment and treatment you may require. Here you can see the anaphylactic algorithm, which you can use as a guide to treat the patient. It reminds you to complete a full ABCD assessment, to call for help, and be aware of the patient's positioning and administering oxygen. It also highlights the necessity of adrenaline as a life-saving drug to administer during anaphylaxis. The algorithm also offers the life-threatening issues, as you can see on screen. Adrenaline works by reversing the peripheral vasodilation of the circulatory system and reducing the edema and swelling of the smooth muscle tissues. Adrenaline can be found in the drugs and fluid drawer of the emergency red trolley. It contains 3 1ml syringes, 3 green and blue needles, and contains 3 vials of 1 in 1000 adrenaline. It must be given intramuscularly and ideally into the outer aspect of the thigh. Please note that this will require proficiency in drawing up medication and giving IM injections safely. If this is not in your skill set, there may be someone with those skills nearby. Please note the expiry dates of the drugs when checking your emergency trolley. Please refer to the anaphylaxis algorithm on the back of the shot pack in your emergency trolley. You will need to administer 0.5 of a ml of 1 in 1000 adrenaline to adults and a reduced dose for children, as shown on the screen now. The Human Medicine Regulations 2012 allows adrenaline 1 in 1000 to be given without a prescription, as it is a life-saving medication. Auto-injector pens, otherwise known as EpiPens, make the administration of adrenaline without drawing up an injection skills possible. Auto-injectors can be administered through clothing, which makes access easier in an emergency. Further treatment in anaphylaxis is hydrocortisone, chlorpheniramine, and IV fluids alongside nebulization. This further treatment should be commenced if respiratory or circulatory compromise is evident. In the event that anaphylaxis has not been resolved through assessment, adrenaline, and subsequent treatment, the patient may well worsen, leading to cardiac arrest. You will need to put out a 2222 cardiac arrest call and proceed with CPR and basic life support. This means starting 30 chest compressions to do ventilations and placing the defibrillation pads on the chest. In summary, what we have covered is the nature of anaphylaxis, what causes it, and what it does to the body and how the body reacts when an allergen causes an extreme reaction. And we've offered a reminder of how to call for help and the necessary treatment and procedures that should be followed under current Resuscitation UK and BSUH guidelines. You will find a more in-depth package on anaphylaxis on IRIS.